quickly go to the CPR demonstration. Someone is going to teach us how to perform CPR in case there is an emergency. Tower count. Adenike Makinde. Please put your hands together for her. Put your hands together for her. Please correct me. What's the right pronunciation?
Tower count.
Tower count. Tower count. Is that Arabic? No, I need to know. I've learned Latin. I need to learn Arabic. That's an Arabic name. Okay, so everybody is tower count. Tower count. Thank you very much. Please put your hands together for her.
Good evening. My name is Tower Count Adenike, but you can just call me Nike for short. And I'm a biomedical scientist, and I'm also a public health practitioner. This is the first time I'm doing something like this, so I'm a bit nervous. When Mrs. Cole messaged me and said, Nike, can you do a short CPR session? I was like, I didn't answer her for like maybe an hour. I was thinking, can I do it? Can I not do it? I was really like, let me not doubt myself. Let me just go for it. Let me just know. Even if it's my first time, I'm just going to do something. So I was supposed to share a slide. I actually prepared the slide, but because of time, I think I would just have to summarize it. So I know we've all heard of CPR before. Is there anybody here who hasn't heard of CPR? Okay, good. So CPR means cardiopulmonary resuscitation. Cardio means the heart, pulmonary means the lungs, and then resuscitation means to revive, that is to bring alive. So CPR is just like a first aid procedure. It is used to make the heart start pumping. When you notice that somebody has collapsed or the person has stopped breathing, or you notice that the heartbeat has stopped, that is when we actually apply CPR. So we have CPR for adults, we have CPR for children. So learning CPR is very easy. It's just like ABC. What you need to remember is the doctor's ABC. So now, doctor's ABC. DRS ABC, which stands for doctor's ABC. So D stands for danger. So now, when you notice that somebody has collapsed, or somebody was electrocuted and then the person fainted, or probably maybe somebody drowned, or maybe somebody had an overdose of drug, or the person suffocated or something, and then you notice that person needs help. So once you get to that person there, you have to first of all check, okay, before you want to even attempt to help that person, is he a safe environment? That's where the danger is. You look at the safety of the environment, ensure that there's safety around you. Is it that there's a fire outbreak and if you try to help that person, you also get help yourself? Is there a place where there are chemicals that are exposed? Is there a place that, okay, maybe if you don't hook up the electricity, you also get electrocuted? So you have to check for the environment. Is there a place where maybe there's a bomb and you know that if you stay there, the building can fall on top of your head or something? So you make sure that the environment is safe. So once you ensure that the environment is safe, you get to the person, and then that R from the doctor, responsiveness, you want to check if that person is actually still breathing. Like you can tell the person and say, hello, can you hear me? You can pinch them by the shoulders too. Hello, can you hear me? Are you okay? And then when you notice that the person is not responding, then you shout for help. That is the doctor's ABC, the S is shout for help, because you may not be able to do it alone. So you can shout for help around. Is anybody around? Can you help me? Help, I need somebody here. So you call for help. Then the A is airway. So this is a baby, although there's an adult dummy that I should be using, but I wasn't able to get one. So this is the baby's dummy and I'm going to use demonstrate. So A is for airways. So airways is that you're going to lift the head of that person like this to clear any form of obstruction. So once you lift the airways like this, you have to ensure that, okay, that person can, if the person can still even breathe, there is no obstruction of the airways. Then the B is breathing. You need to check if that person still has a little chance of breath in them. You can actually come close to them and see if you can feel their breath on your face. You can look at their chest for maybe little movements. If you can see little movement on their chest, you can also look at it too as well. But immediately you notice that, okay, there is no feel of breath, there is no movement. So if you can notice that you cannot feel any breath on your face, you can't see their chest moving, then the next thing to do is to start CPR. That is the C in the doctor's ABC. The C is for circulation or compression. Now, why are we doing CPR? Now, we are doing CPR because we want to exert pressure. We want to make the heart to pump blood to the vital organs if it's still possible. That's why we actually do CPR. That's the part of CPR. So let's say somebody drowned now and then bring the person out of the pool. The first thing you try to do is that you try to press their chest. So now, there is a hand placement for the CPR. So what you do is that you place the heel of your hand, whichever hand you're comfortable with. Some people tell you that, I use my right hand better, or my left hand, whichever one you're comfortable with. You just place it in the middle of the chest, the breastbone. Medically, we call it the sternum. So you place it there, that's where the heart is located. And then you interlock your fingers in between it, and then you push hard and fast. In quotes, hard and fast, because you have to be faster than the heartbeats, normal heartbeats, to be able to revive the heart. So you place your hand in the middle of, this is for an adult CPR now, I will still put through the child and the infant CPR. So you place your hand in the middle of the chest, you interlock your fingers, and then you press hard and fast, hard and fast. Now the hard and fast is 100 to 120 compressions per minute. That is how hard and fast it is. If you can do 30 compressions for 15 seconds, so that is how you do. You press it. Within 50 seconds, ensure that you do up to 30 compressions. And then we also have what they call rescue breaths, where you have to tilt the head and then put in breath into the person's mouth. But you know, nowadays, because of people are always very cautious, oh, what if that person has a disease that I can contact? So we usually don't advise people who are not trained to do the rescue breaths. If you're not a trained professional or you don't really have idea of what CPR is, we just advise you to just do hands-only CPR. So now, like I said earlier, that why do we need CPR? You know, if somebody has collapsed, or the person is electrocuted, and if the person is still breathing, you may actually not need to do the CPR. You just make sure that you call an ambulance and then monitor the person. And when you shouted for help and somebody is coming on the way, you make sure that you are also calling an ambulance, because number one, they can actually direct you on the procedure, because you may not really be learning about it. They actually direct you on the procedure, and then you have to tell them the location that you have, because the CPR is just to be able to revive that person for that particular moment. The person will still be needed to take, will still need to take to the hospital. I don't know if you understand. So that's just the essence of CPR, just like a first aid technique. So while somebody is with you and the person is calling for help, I know in Nigeria, because America now we have 911. I think in Abuja we have a rescue, a medical response team. I think it is 112 or so. Yeah, we have 112. In Lagos, we also have 767. I don't know how effective it is, but I know that those are the numbers that you call. So when we have them on the speaker, they can direct you on what to do. You're also giving them the address of where you are so that they can come. So another thing that we can also do, although we don't really have it in Nigeria, there's a small device they call an AED. That AED means automatic external defibrillator. So in more developed countries, you see that in public places, workplaces, restaurants, they usually have it there because of issues like this. What that AED does is that automatic, it tells you what to do. So you can say that, okay, this person now, it helps to give shock to the heart, but to direct you on how to place the apparatus on the person so that it will deliver shock to the heart, and then you can continue with the CPR. But I don't know if we really have that here. Maybe we have some places that are unaware of this. So that will also help to revive the person. So the thing is about CPR is that it can double or triple the chance of saving lives when we have all of this issue, and it is very, very necessary for everyone to have an idea about it. We have places that one can go for the training. We have Red Cross. We also have this basic life support from an American Heart Association. I think they have places even here in Abuja. I think at Teaching Hospital, even at National Hospital, they have these courses and programs where you can get to practice it life there. So you can always go there and apply for it. You just pay a token of it. So now I'll go to the child CPR now. Now for children, now you know that they're actually small and then they're febrile. So what we do is that instead of using the two hands like this, we use 2 fingers. So we use 2 fingers and we hold them like this. We are still positioning our hands in the center of the chest. So we are going to do that same number of compressions that we do, 100 to 120 per minute. I forgot to mention something about the depth, because the number of compression and the depth is very, very important in ensuring that your CPR is effective. So the depth is 2 inches, that's like 5 to 6 centimeters. Wow. So when I said hard and fast, that depth is 5 to 6 centimeters. So for a child, you hold them like this. Remember, you're also going to put a call. They're going to shout for help before you're going to do this. So while you're calling for help, while someone is helping you to call for help and then the phone is on speaker, you're trying to do the CPR, you're holding them like this, tilting them a little, and then pressing hard and fast with that same depth as an adult, but with 2 fingers. So now for choking, children, they can put a lot of things in their mouth, their nose, and anything. So that is, I won't call it CPR, but there's a method I use to revive them from such instance. So this is the child now. You place your diaper above their neck, and then you give them back blows. They call it back blows. So you give them 5 back blows, and they should be between the shoulder blades. I don't know if you guys can see me clearly.
Yes.
So you do 1, 2, 3, 4, 5. This helps with choking or suffocation for children. So I would like to ask maybe just 1 or 2 questions to quickly. I want to know if you all understood what I actually explained now. So first of all, for an adult CPR, how many compressions are we going per minute?
Thank
you, ma'am. Thank you. So also, for children, what is the hand placement for CPR?
2 things.
Please let's put our hands together for power parts. Today is like the highlight of my week, because in just one day, I'm a medical doctor. I'm a language professional. I speak Latin and Arabic fluently, by the way. Thank you very much. You understand? See somebody appreciating me. But when people are just looking at me like, what is she saying?